As primary care provider, one of my job is to help patients to quit smoking. So in today's video, I'm going to share with you how I counsel my patients in my office to help them quit smoking. Now, for my non-USMLE friends, this would be another video of communication and interpersonal skills, something that you can learn on how we actually help patients to quit smoking in the US healthcare settings. But the unique thing about this video is it serves large audience as well. So if you're somebody who is trying to quit smoking, this video is also for you. You can see how the doctors can help you to quit smoking. If you're non-USMLE interested to learn from me, I do offer clinical rotations. You can use the link down in the description below. I help IMGs to improve their communication and interpersonal skills, learning the US healthcare system, and master the EMR, because we come from completely different language, culture, and system. And I am a non-USMLE myself and need to adapt to these differences. So I'm doing the same for all of you guys. So again, if you're interested to do that, just use the link down in the description below and you put your name and email address, and then you will get an email that explains about the clinical rotations. Now let's dive into the topic. So the very first step that you want to do to help patients to quit smoking is just basically ask, do you want to quit smoking? That's always the first step. Now, if they answer no, then the conversation ends there. You're just gonna waste your time because the patient is not ready to quit smoking. So it doesn't matter what you're gonna say. If you say, well, why? Smoking is really bad for you. I need to advise you to quit smoking because you're gonna get short of breath, you're gonna get to COPD and cancer and heart attack and stroke. Guess what? They already know. Most patients, if not all, already know why smoking is bad for them. And that's not the reason why they not quitting. They're just not ready yet. So you cannot change that. I usually tell them, I see, I understand, but hey, when you're ready to quit, let me know. I definitely can assist you with that. That's it. End conversation. Move on to the next thing. If the patient say yes, or they think that I think I should quit, I was thinking of quit, so debating to quit or anything like that, that means you actually have the permissions to move forward to the second step. The second step is ask, why do you want to quit smoking? Now, this is the beginning of the technique we call the motivational interviewing. The idea is we need to bring out the motivations from the patients internally. We need to find out their motivations to quit smoking and drawing out from them. Again, but the motivations cannot come externally from you. It has to come out from the patients using the patient's own words, because everybody is different. Everybody has a different values. Everybody has a different motivations on why they want to quit smoking. So we have to use an individual approach in this case. The third step is to explore the motivation or explore the reasons why the patient wants to quit smoking. So I'm going to give you an example. Let's say I ask, why do you want to quit smoking? And the patient is going to say, usually related to health, just giving you an example. Well, I think it's because it's not really good for my health. What do you mean by that? You see? So you explore more. Yeah, I think, well, I mean, it's really bad. It damaged my lungs. What do you mean by damaging your lungs? What happened to your lungs if you smoke? Well, I guess it makes me hard to breathe and have cough. Right, exactly. You feel more short of breath. You can get cough. It's not gonna go away. And what do you think it's gonna feel like when you have short of breath and a cough? And they will try to describe with their own words what it feels like feeling a short of breath. And then you're gonna keep exploring more. Yeah, how do you feel if you live like that for many years? Actually, what I'm trying to do is to bring out those motivations to life, to something that's more concrete. Because here's the thing with people who try to quit smoking, they are all abstract thoughts. I feel like I need to quit. I don't think it's really good for my health. But they never really think about it. There is some lack of insight. They don't really sit down and think about the bad things of smoking or why they need to quit smoking. They never really think about that. So our job is help them think during our session. By doing that, it brings really out the motivations into life, something more concrete, something that you can visualize, or it doesn't have to visualize. It's something that you can see, hear, smell, taste, or feel. Something that's more related to our senses, because that way the motivations become clearer and clearer, and they will become more motivated to quit. Usually once I explore with these questions a little bit more, have them more visualized, have them feel, like understand, and then put more thought about it, usually when you get at that point, the patient's usually going to say, yeah, I think I need to quit. So that is based on my experience what's going to happen. Now, if you have get there, you're ready to move on the next step. But here's the thing, I would like to explain a little bit more about this step. Again, the idea is to bring these into life, something that is more concrete. But there is endless possibilities. I'm just giving you one possibilities of, well, it's going to be not good for my health, which is a common one. But it could be anything. I'm going to give you an example. What I did yesterday, I just counseled a patient to quit smoking yesterday. When I asked her, why do you want to quit smoking? She said, because of my granddaughter. So that's a very different motivation altogether. Of course, the next step is you need to explore. Can you elaborate more why your granddaughter is your motivation, or why you need to quit for your granddaughter? And then she said that, well, she's just very sweet, loving, and kind. She is so cute. And after exploring a little bit more, basically she wants to live longer so she can see her granddaughter growing up. So that was her motivation. Once you get that, how can we bring these motivations more into life? Something more concrete, something more that she can see, hear, feel, taste, or touch. You just have to be a little bit creative for this. For example, like if it's possible for her to have, this is probably the best one, have a common or more often interactions almost daily with her granddaughter, of course without smoking, then that's probably will really help her to quit smoking, because she has a constant reminder, and because she sees her, she feels her, she play with her, to actually quit smoking. If that's not possible, you can use whatever, pictures, videos of her granddaughter. So put her pictures in the fridge, multiple places, so she can get a constant reminder. Looking at the videos every day, that becomes a constant reminder. Once you have that motivations, bring them into life, something more concrete, something more that you can see, hear, feel, taste, touch. That is the third step. Now we have made the motivations clear. We know why the patients want to quit smoking. The next step is avoid trigger, because it doesn't matter how good the motivation is, if you're being exposed again and again with the really bad triggers, then the chances are you're probably gonna lose. You want to avoid those triggers, so identify what those triggers are and then avoid them. If the triggers is going to the bar, then go to the bar, as simple as that. However, I'm completely aware that you cannot avoid all triggers, but at least you avoid the common one. At least you avoid the things that you can avoid. That will really increase the chance of quitting smoking. Tell them what are your triggers, what are the things that make you want to smoke, and let's figure out a way how you can avoid them. The next thing is you have to come up with a plan when the triggers happen. So when it triggers you that you feel like you need to smoke, you need to have a plan to deviate yourself away from smoking, because like I said, you cannot avoid all triggers. It's almost impossible. You avoid the things that can be avoided, but the one that can be avoided, we have to have a way to handle it. And the way to handle it is to have a clear plan on what to do when that happens. Please note that you need to prepare ahead on what you're gonna do. You cannot just, I feel like it's like, okay, I need to do something else now. Oh, what should I do? No, you can't just thinking on your feet. It's not gonna work. You have to have a plan, prepare it ahead. There is some rules of this. I would typically separate this into two things. One is the short-term techniques, and the other one is like a middle or long-term techniques to avoid the relapse. So the short-term would be something that has to be quick, easy, effortless. For example, as easy as looking up. It could be. So when you feel like, oh, there's big urge, you just look up. It's quick, simple, easy, effortless. But that's just one example. Some people do deep breathing. That's also quick, simple, easy, effortless. Right? Some people who are religious probably pray. Some people maybe meditate. So whatever that might be, as long as it follows the rules of simple, effortless, and very, very quick, that will work. Now that would be your short-term plan strategies to just quickly defeat you away from the urge of smoking. Then that urge would kind of like dies down a little bit. Then you will need to find some form of activity that deviate you away from continuing having the urge. That could be anything. Could be go to the gym, going to do exercise, playing video games, call a friend. You just have to come up with a strategy that would work for you. But remember, it has to be prepared ahead. You cannot just think on your feet. So now we have laid down the motivations. We have clear on motivations, bringing it up to life. We identify the triggers, try to avoid them. And even if the triggers happen, we have a plan to avoid going back to smoking. Those are really the foundational principles of pretty much everything. There gotta be some practical things that you need to do, and we're gonna talk about the practical stuff. Now, I usually have a smart phrase in Epic EMR. Well, I provided it in after visit summary for the patients when they leave. I kind of like go over it with them. These are very, very practical steps that you're gonna do. So first step is set a quit date. Simple as that, because you want to prepare ahead on doing all the preparation that I just mentioned to you. If it's your granddaughter, then when you prepare all the pictures, all the videos that you're going to watch, etc., buy the medications, yada, yada, yada. So you want to have a quit date so you can prepare. The second step is to ask for support. So you want to reach out your family or your friends or whoever is important for you who can help you to quit smoking. If you and your spouse smokes, I would highly recommend both of you have a same quit date together, so you both quit together, because it will be very hard if you live in the same household but one smokes and one don't, and only one person quit and the others don't. I figured that becomes very low likelihood of success. So both of you need to quit. So look for support. It's very hard to do it alone. Find people who can support you and encourage you along this difficult journey. The third one is, for me personally, I like to use referral to a smoking cessation program. Every hospital and clinics in the US typically have some form of smoking cessation program, because you want to have a close follow-up with these people. You want to have to encourage them to quit smoking. They will require some extra layer of support. It's quite difficult to do it alone because smoking cessation counseling already take a lot of your time, and there's a lot of things that you need to take care of for the patients, like all these chronic conditions, diabetes, hypertension, the vaccinations, colonoscopy schedule, etc. So I would typically refer the patients into some form of smoking cessation program. There are also a third-party smoking cessation program out there that the patients can also sign up for. Some common triggers that needs to be removed, like ashtrays or the cigarettes itself. Your car has to be clean if they smell of smoke, your house, etc. That's also part of preparations, hence the quit date. These are very simple, common triggers that I think anybody can always do. The major triggers, like somebody passed away or somebody got sick or your dog got sick or whatever, it's very hard to predict, and that's why we have the plan to face that, like if that happens, to avoid the relapse. But the very, very simple things, the very common things like ashtrays and cigarettes in the house, we need to get rid of all of that. If it's possible, I would typically recommend avoid alcohol as well, because they kind of like go hand in hand for this. Now, once all that done, then we get into the pharmacological options, which is where a primary care doctor like me can jump in and help to assist those cravings when that happen, to make it easier and increase more the likelihood for patients to quit. So we have three pharmacological options. The first one is varenicline, or the brand name Chantix. It's a partial nicotine agonist. The second one is nicotine replacement therapy, which has the nicotine patch, and then for the short cravings, gonna be gum, lozenges, inhaler, or nasal spray. The third one is bupropion, or the brand name Wellbutrin. So three options there. Out of three, based on studies, the best one is Chantix. So we're gonna talk a little bit about these medications one by one. Varenicline, or Chantix, is a partial nicotine agonist. Again, it provides the highest success rate for smoking cessation. The main side effects, which I usually tell people, is vivid dreams, abnormal dreams. If the patients have some form of PTSD, maybe they can have really bad dreams. The patients don't, they can have weird dreams, funny dreams. It's just random dreams, but they can be very, very vivid. There is a concern of like neuropsychiatric event or cardiovascular that has been debunked. There is no side effects related to all of those. In general, it becomes a very, very safe medications. Don't want to get into details on the dosing regimen, but Chantix typically taken before your quit date and then continue on after the quit. It's about a week before the quit date, you're gonna start that, and then you continue on without the cigarette. And usually comes with the starter pack and continuing pack. You can also order it separated, whichever you feel like, whatever insurance gonna approve. So that's Chantix. Chantix cannot be combined with any of those two, nicotine replacement therapy, bupropion. So you cannot do like, okay, let's do Chantix and nicotine replacement therapy, or let's do Chantix with bupropion, or let's do all three at the same time. No, it doesn't work that way. If you use Chantix, it's gonna be only Chantix. The next one is nicotine replacement therapy. You have the nicotine patch for like a baseline basal nicotine, and then there is for the cravings and the urge, you're gonna use the form of gum, lozenge, spray, or inhaler. Nicotine patch comes with the 3 doses, 21 microgram, 14, and 7. Typically, patients who smokes above 10 cigarettes, that is half pack a day, would require 21 microgram. Most patients who's really addicted to smoking typically would smoke at least half pack a day. So by default, you're gonna start with 21 microgram anyway. So you're gonna use 21 microgram for a month, 14 for a month, and then after that 7 microgram a month. So you taper down that way. The difference here is that in nicotine replacement therapy, you're gonna place it on the quit date. So the patient decides, let's say May 1st is the quit date, and you're gonna try to not smoke on that morning and then place the nicotine patch starting in the morning. 21 microgram. Now, one of the common side effects of the nicotine patch is the skin irritations. That's pretty much it. And the common complaints that I get from my patients is that it doesn't really attach really well. So you want to make sure that the area is clean, you dry them, and you want to put in the area that has the less hair, and then you want to rotate them. And if it still doesn't work, you can just add some adhesives, tape or whatever. As long as you don't have any allergy to it, you can use that to keep them attached. You will have that cravings, right, when you try to quit smoking. We have a plan to do that, but again, the pharmacological options kind of help with the cravings as well. Out of the gum, lozenges, inhaler, and spray, my favorite is actually inhaler. And just based on my experience, not based on studies, actually I have more patients successfully quit using the nicotine inhaler compared to people using Chantix, interestingly. I think the reason is because of it's fixing a lot of the hand-mouth habit, putting something in your mouth. But the nicotine inhaler is created like a cigarette, so they can use that to put in their mouth and then feels like they're smoking, but it's just like a small dose of nicotine. And it's really helpful. I have quite a good success with it, amazingly. And they're pretty happy with this. They just keep them in their pocket. They don't really need much amount of those. Again, these people is just of some form of a habit, so they use this and then they're able to quit smoking. Now there's the pro and cons for each. Like the gum, for example, it will not really work with if you use a dentures, and then the one they put them out, like gum and lozenges, both you cannot consume with acidic beverages or food. So there is some downside on that, pro and cons, but in general it's very tolerable. Again, my favorite is usually nicotine inhaler. The downside is, based on my experience, some of the insurance company does not really want to cover the nicotine inhaler and can become expensive. So that's kind of like the downside of this one. And another side effect of nicotine inhaler is feeling a sore throat and can cause some irritations. You can have some dry cough with it. Now we move on to the last one, which is bupropion, or the brand name Wellbutrin. Wellbutrin is a medication that we typically use for depression. It can try to kill 2 birds in 1 stone. If the patient is a smoker and also have depression, so that would be a good fit for that. I use bupropion typically for that. As an antidepressant, unlike the SSRI, the bupropion does not have sexual side effects. And on top of that, when you quit smoking, you will typically gain some weight. It could be 8 to 10 pounds. Now, Wellbutrin kind of suppress those hunger as well. And it's actually one of the medications, an FDA-approved medications, that can be used for weight loss when you combine it with naltrexone. The main side effects and absolute contraindications for Wellbutrin if the patient has a history of seizures, because it lowered the seizures threshold. So definitely always ask history of seizures, or make sure the patient's not taking seizures medications, because that's contraindicated. In Epic EMR, the system that I use, if the patient is taking some form of or has a past medical history of seizures, they automatically alert when you try to prescribe the medications, which is great. But pretty sure that's a very great safety net system, but you should know that as well. Now, Wellbutrin can be combined with a nicotine replacement therapy, and then the effect becomes almost as good as actually Chantix, but Chantix is still considered the best one based on multiple studies. So those are a very quick rundown on how I typically counsel patients to quit smoking. I hope that's helpful for non-US IMG to know what we typically do in the US to help them quit smoking. And if you are a smoker, hopefully these techniques can also be applied to you, and hopefully this can also help you to quit smoking, save your money, and be healthier. Thank you for watching. I'll see you again in the next video real soon.